Deputy Provost and Assistant Dean and everyone at the Faculty of Liberal Arts and Professional Studies and here at York University. Firstly, I think a lot of us didn't realize that this was the Thursday night of a long weekend with lots of different kinds of celebrations happening. So I brought a bag of jelly beans. I hope you'll pass it around. You'll have to do some long reaches and take some. And the gummy rabbits are sour. The others are sweet. To the members of the Lundy family, it's a real honor and privilege for me to be able to speak at this lecture named for Kitty. One of the things that wasn't in my resume was that going back to the late 60s, I was trying to figure out probably about 68 or 69, I came a number of times to Atkinson to a course that a friend, George Martel, was teaching on poverty and social change. And George and I were part of a group in downtown, the sort of Cabbagetown area of Toronto, who were organizing and did organize an alternative school. And George often had those of us who were working in education reform and community development to come as resource people at these seminars on poverty and social change. And it was at one of those, and particularly I think at the pub after the lecture, that I met Jane Jacobs, who went on to have an enormous impact on me and how I saw cities and communities, and to think about things like safety in terms of the activity on streets and how places were built, and less about security and or traditional security and policing. And I've had an opportunity in the years since to be part of great discussions at Atkinson, and then I hung out at Osgoode across the field for a few years when I took law there. Mental health has been peeking out of the closet for a long time, and I'm sure all of us, by virtue of being here, believe it's time that it came out fully into the open. We've all heard the stats. 1 in 5 Canadians will suffer from mental illness at some point in their lives. Most of us don't even need to hear the stats. We know from our own experience within our own family. And I certainly learned about the frequency of mental illness in my family. My mother was what was then called manic depressive. Other members of the Broad family who experienced various mental illnesses. And I not only knew about the illness, I also knew about the secrecy, and was certainly a part of that. So it's good to see the door opening. And it's pretty hard these days to pick up a newspaper and not read something about mental health, mental illness. And here we are at a university. We certainly hear a lot about what's happening on university campuses, and particularly amongst young people, and the debate about whether the numbers are on the increase, and talking about both on the one side the enormous social pressures, the implications, the bullying that often goes with the new technology and more sexualized school settings. Whether there is more, it really is hard to tell. And we know, as we look back, that mental illness was pathologized and stigmatized, and in many ways made exceptional. People didn't want to talk about it. It was something that needed to be treated, and in many cases was shuffled off to the big stone walls. I think it's so fantastic at Queen Street when the redevelopment happened there of the regional, the big regional hospital there, that people fought, psychiatric survivors fought to keep parts of that wall because it was so symbolic. There, in the middle of the city, many towns across this country had those big, dark places on the outskirts. And there'd be the jail, and there'd be the psychiatric hospital, and children were sort of alternatively threatened with one or the other as ways of responding to us when we acted out. But as I've said, we're seeing change, and we see people like Clara Hughes, who we all cheered for in the Olympics, talking regularly about her own experiences with mental illness, and part of the Bell Let's Talk. And I know York University has actively been a part of that. And these kinds of campaigns are important to break the stereotypes, that they show that highly productive people who've achieved much have suffered or suffer from mental illness, and therefore maybe it's just not just a lazy person's disease. I know over the years a number of friends of mine, people close to me who've committed suicide because of mental health issues. And I've been very frustrated on a number of occasions to go to funerals where there was no reference to what had happened. There was nothing in the obituary. It was something had happened and the person died, but there was no discussion. And I know how frustrating that was for people who were aware not to have an opportunity to share the stories, to talk about it, to deal with the guilt that goes with being survivors. And I guess I'm in my late 60s now and probably prone to skimming the obits more than I used to. And so I see a couple of things related to this. I mean, sadly, I see more and more pictures, and of course now they have pictures, so you have a sense of the age of people and of young people. And I often just stop and look at them and skim it, and sadly many of them are young people who died with mental illness. The good thing, the healing thing, is that the obits talk about that, and the families talk about that, and many of us probably read the story of the family whose son recently died of suicide in one of the Toronto papers a weekend or two ago, really talking about their experience and wanting people to talk about these issues, not just in obits or at funerals, but as communities on an ongoing basis. So lots of doors, lots of walls, lots of something being not quite right, but people not talking about what it really was. So what about us at the Human Rights Commission? Well, in a way, the same thing went on there. Going back, the Ontario Human Rights code has been in existence for just over 50 years. Started out 52 years ago with the grounds of protection being race and creed as a result of very overt racism against primarily the black community and anti-Semitism against the Jewish community. And those communities organized together with people from faith communities and unions and other social justice seeking groups, and the code was put into place. It wasn't until the 70s when disability was added, and over the years since, communities have organized and fought and advocated, demanded, and got protection. And the most recent being last June, when gender identity became a protected ground, an explicit protected ground in the code. So disability was there going back to the 70s, and disability clearly included physical disability and mental disability. And when I came to the commission 6 or 7 years ago, I was interested that the largest single grouping of complaints that came to the commission were in the area of disability, but virtually all of them about physical disability. There were very, very few complaints dealing with discrimination on the basis of mental illness or addictions. And yet I knew from the many lives that I'd lived in different jobs and whatever, that there was a lot of discrimination out there. There was a lot of, there were a lot of barriers that discriminated in a way the code provided protection, and yet they weren't reflected. So I said, there's a problem here. In the same way people aren't talking about it in other places, or standing up in the workplace or in the community, they're also not coming to the commission. And we need to go out and connect with that community. So we did, I guess about three and a half years ago, we did a consultation. We held meetings around the province. We had public meetings. We connected with places that people with psychiatric issues felt safe. We went to a lot of drop-ins to places where vulnerable people would feel safe to talk. We had an online survey. We invited people to tell us their experience with discrimination and barriers based on mental illness. And we got the largest response to any request, any outreach we had done at the commission in its 50-year history. We heard long, carefully written submissions about people's experience. And it was pretty, sometimes disturbing, upsetting, because we heard about a lot of problems. But the good news was we also heard some good stories. We heard about how people had problems, how they'd resolved them. We heard some things that we call best practices, I guess, where organizations, institutions had done a really good job of including people. But we clearly heard a lot. And the report, Minds That Matter, that you have, is a report talking about what we heard. And I'll talk more about what we're doing with what we heard, but that really is talking about what we heard, and some preliminary recommendations we've made on the basis of that. We heard a lot about stereotyping. and how this stereotyping is often used to deny people housing, services, and employment. And that we heard about organizations developing policies or practices that impact people in negative ways, which reinforce stereotyping. For example, we heard a lot about people with mental health issues and addictions being stereotyped as dangerous or at risk. And that is often used to restrict services and housing and has serious implications in employment. Another common stereotype we heard about is that people are assumed to not be able to make informed choices for themselves. And the experiences or perspectives of people with mental health issues are often minimized, trivialized, or assumed to have little credibility. We heard people use language like, nobody cares, I'm irrelevant, my words will be discounted. I do not matter. And I'm sure you can get from that, that's what the report is called, Minds That Matter, because they do. Many pointed to the role of media in shaping public opinion and perpetuating stereotyping. And we are seeing a lot more positive media coverage or media campaigns that aim to normalize mental health disabilities, but we can't ignore the fact that media coverage of news events involving people with mental health issues can often be alarmist or portray people with mental health issues as dangerous. A lot of people spoke of the impact of that and how it makes people reluctant to talk about their mental health or ask for accommodation. A vicious circle that can limit access to employment, housing, or services, and thus exacerbate mental health issues. One consultation participant told us she was so afraid of the stigma attached to discussing her mental health that she quit her job as a librarian rather than ask for a needed leave of absence, something she was entitled to as a result of the duty to accommodate. We heard a lot about how people with mental health or addictions face high rates of poverty, lower income compared to people without disabilities or people with other types of disabilities. And people told us that the discrimination in employment, education, and housing contributes in a real way to having low income. They're unable to get jobs or to complete their education. They have fewer life choices, less income. And about how that poverty leads to more exclusion and discrimination. And how that also plays a role in housing and the real difficulties in finding safe, affordable, and adequate housing. And we heard the stories we all know, people on the waiting list figuring out that probably they could get a unit in 10 years. We've done a lot of work at the Commission around housing, and we know how racism, homophobia, sexism, discrimination against families can exist in terms of seeking housing. But it was interesting when some testing work was done comparing how people with mental health issues as compared to people in racialized groups, single moms with young children, groups like that, how they were treated. And in the situation of the racialized people, the family housing, it was clear that landlords understood that discrimination was against the code on those grounds. And whether they were discriminating or not, they never said anything directly about it. When it came to people with mental health issues, they said, no way, we don't want any of those blank blank people. And we know the word, crazy, half a deck, whatever. We don't want those people in our housing. Not only did they express barriers, they were also very overt about it. They didn't see it as a problem to say that. And we know that means people have difficulty finding housing. They often end up in substandard housing. Sometimes they end up having to be in supportive housing when they could live more independently if independent housing were available. So it really plays out in many different ways in terms of housing. And we heard about how discrimination based on other grounds can contribute to mental health. So we heard how people who experience racism, for example, that can affect their mental health. When newcomers come to this country with all kinds of wonderful training and credentials, and they keep being met with Canadian experience, where's your Canadian experience, that can have an impact on their mental health. So other code grounds. We heard a number of stories from Aboriginal people about the stereotyping of them. And that's that part, the drug and alcohol, that often they were assumed there were stereotypes about them in relation to that. We also heard from women who shared experiences of sexual assault or harassment. And when they reported it, they were told that it was all part of this one woman, of her illness. We heard about discrimination in terms of services. So people with mental health and particularly addictions often had difficulty getting physical health care services either in hospitals or from individual doctors because they were presumed to be drug seeking or looking for things related to their addiction. We heard from one person who had gone to hospital with major abdominal pain, told the people at Emerge that she was on methadone. They determined she was just there trying to get drugs. About 10 hours later, after she passed out from the pain, they determined she had major abdominal problems and did emergency surgery. We heard from people talking about the fact that when they go to hospital or emergency and it says anything about a history of mental health related issues, that the security or the police were brought to be there. Again, going back to that stereotype of danger. Under the Human Rights Code, there's a duty to accommodate disability to the point of undue hardship. And yet we heard from many people where in employment where employers didn't believe that mental health issues were real disabilities that required accommodation. And people were told, look, take the job the way it's being offered, and if you can't do that, then resign. A lot of ignorance about the duty to accommodate, and people talking about when they asked for accommodation that they were harassed by landlords, by fellow tenants, employers, co-workers, or service providers. And then inappropriate process around accommodation, intrusive questions, excessive demands for medical information, social isolation or shunning in the workplace, and sometimes assault and sexual assault. Some people experience what we call in human rights law a poisoned environment, where one comment or action is so severe that it makes it impossible to participate equally in the environment. And I can't think of a better example of that, a ghastly example of a woman who told us that her surgeon, who had just operated on her and had chatted with some other healthcare people during the operation, and as he came to talk to her during recovery, said, had I known you were crazy, I wouldn't have operated on you. Just like some people, and we heard from a lot of people who didn't know what their rights were, some people and organizations told us they had a hard time understanding how the duty to accommodate applies to people with mental health or addiction, disabilities. And there was a case, just as we started to do our research in the Ottawa area, of someone who did file a complaint based on a mental health issue. And that was Mr. Lane. And he had a job, got a job, a fairly high-level job in the technology, security technology business. And Mr. Lane had lived with bipolar illness for quite some time. And so a couple of weeks after he was hired, he went to his employer and said, I have been diagnosed as bipolar, and I found some ways of dealing with that quite well. And if I'm starting to go into a manic or a high phase, certain things will start to happen. And if people see those and recognize them and bring it to the attention of, I think, his wife or his doctor, then there are interventions that can be made which will reverse that. So will you do that? And the employer sent him home and asked for a whole pile of medical information, more medical reports, and then asked for him to be seen by their medical people. And finally, they stopped asking and said, you can come back, and he came back and they fired him the first day back. And his life then fell apart, and an awful downward descent. But he filed a complaint. And it was an interesting decision because it was the first time that the Human Rights Tribunal made it clear that not only was there a duty to accommodate, and it was required, that there was also a process that had to be gone through. I guess the employer made some arguments because of the security aspects of the job, they might not be able to accommodate him. And the tribunal said, you don't know the answer to that question because you never even tried. There's an obligation for you to attempt to accommodate him. It may be when you go through the process, it's impossible, but you didn't try. He'd only worked there for a couple of weeks, and the order that he got was something like $100,000 from the employer for damages and some other things. The employer appealed, and it was held up on appeal. So that case started to send a message to employers that you do have this obligation, and it's not just substantive, it's also, there's an important process component, and you need to do that. So we heard from people saying, we want to do the right thing in order to accommodate, and that was a very good thing, and people raising issues about the kind of processes they had, requirements that they applied to everyone but could negatively impact people with mental health issues. And so they came with many different specific things asking for help. And some of the basic principles that we replied to them were, firstly, whenever you're going through a process of responding to a request for accommodation, it's important that you treat the person seeking it with dignity, that you respect their privacy and confidentiality. A number of people told us that employers always want to see all their medical reports. Employers have the right to know what medical experts believe is required for, in order for you to be able to do the job, not have the details of your medical chart. So that privacy and confidentiality and dignity is important. Often we heard that employers want a template, try and put people into a template. Well, we had someone else who had experienced depression, and this worked for them, therefore that will work for everyone, instead of understanding that accommodation is an individualized thing, and what works for this person doesn't necessarily work for me. Also, that accommodation isn't about the employer telling the person this is what it needs to be, but it's a two-way process, a partnership, and the code requires that both parties be a part of exploring accommodation, and that the goal is full inclusion. And I mentioned shunning. Somebody told me recently, we didn't hear in the study, but someone told me a story, somebody who was a consultant who worked in a company, a large company, around disability issues, and somebody had been off work with a major mental health issue and was coming back to work, and they negotiated how that was going to work. And then at the last minute, the person who'd been away said, no, that's not going to work for me. The person who was telling me said he heard her say balloons under her breath, and she left, and as he walked out with the representatives of the employer, he said, does balloons mean anything to you? And the employer said, oh my gosh. They worked in a big open area where, I guess, partitions up, but the top was open. And whenever anyone was away for an extended period, you know, or whether it was mat leave or, you know, cancer, various things, they always bought a big bunch of balloons and put them in that person's workstation the day they came back that said to everyone, Barbara's back. And people would see that sign and they would come and it was joyous and it was this positive thing. Nobody suggested balloons. Now they were thinking she wouldn't want balloons. She wouldn't want to draw attention to the fact that she'd been away. And yet the lack of balloons, nobody asked her, what about balloons? And she thought, they really don't want me back. They're not going to include. And, you know, somebody made the approach about balloons and she was thrilled and they came back. And, you know, so it's again, it's having that, that conversation. We heard a lot of concerns about issues within the mental health sector itself, and a lot about the lack of appropriate and coordinated mental health services, and how mental health, part of healthcare, is often marginalized from the rest of the healthcare. And we heard about certain groups of people having a hard time accessing services, particularly the very poor, people who may not speak English or French, people in the correction system, lots of different groups. And we heard about issues in treatment approaches, the inappropriate use of restraints, harassment, not being able to get into treatment, forced treatment, and not being given an opportunity to provide input into one's own care. A lot of issues there. We heard a lot about advocates. You had Pat Capone here this morning, a fantastic advocate. Many of you, I expect, are advocates who are pushing these issues and working and pushing and building to make sure that complaint systems like these kinds of issues in the mental health system become accessible and easy for people to navigate, so they have an opportunity to put forward and enforce their rights. So we heard a lot of stuff from those thousands of people, and I've just given you a survey. So what do we do with it? We all hear about studies or consultations where you get a whole pile of stuff and nothing happened. Well, firstly, we made a bunch of recommendations, I think around 50 plus, for other people. And we're going to monitor them and report publicly on how people are doing with them, and we've offered to assist them. We are very aware of Canada's international obligations under the UN Convention on the rights of people with disabilities, as well as under the Charter and the Code. We've been working with, and we made recommendations around how police release information on police record checks. Because people with mental health issues who may be taken to the hospital sometimes because they're at risk of harming themselves, perhaps, or someone else, and the police drive them, those things show up when they're seeking record checks, which, as you know, you need for almost everything today. Travel, but also students, co-op programs. You need a record check, this involvement with the police comes up, and so we make recommendations around that. We made specific recommendations to the Government of Ontario about the use of restraints in facilities and recommendations around that. You can go through the report, and a lot of issues that we made recommendations to other people. We made recommendations for others, but we also made commitments for ourselves. And one of the first is that we're in the process of writing, and we committed to write and release sometime this year, a policy on human rights and mental health. And our policies are really guidelines on how to interpret the human rights code in the area of services, employment, and housing, the main areas that the code governs. Our policy is used by judges in courts. We regularly argue it at the Human Rights Tribunal, but also the Supreme Court of Canada. So it's our best advice on how to apply the code. And there's a lot of best practices in it, a lot of how-tos. And we know that many employers, many service providers look to our policies in order to do their business, to carry on in a way that won't create problems or is less likely to create problems with the code. So we're actively working on that policy, and we'll do extensive public education on it around the province when it's completing. We're also working with organizations on, in a partnership, on ways that we can help. For example, we're committed to working with a major mental health hospital to engage in human rights organizational change within that organization. We're doing that with police services around racial profiling and around mental health and other forms of bias and discrimination, and we will do that with organizations around mental illness. We will conduct public inquiries and use our legal functions to address systemic issues, and we will comment on and intervene on legislation that comes forward that we believe has a negative impact on people with mental health. We are also doing work around municipal housing, and maybe partially because I was city councillor and a mayor of a municipality for a number of years, advocating for social housing, and saw how often that awful thing called NIMBYism, not in my backyard, reared its head. And so now we're looking at how we can use the Human Rights Code to play a role in getting rid of zoning bylaws, planning processes that discriminate against vulnerable people, particularly people with mental health issues. So right now we're engaged at the Ontario Municipal Board in Hamilton, where Hamilton Council has refused to allow housing for young women with mental health issues in a particular area because it's too close to to some other supportive housing, and there's a distance requirement between two kinds of housing in that area, as there is in a lot of municipalities. And municipalities are mad that we're there raising these issues. They're saying, we've always done it this way. What do you mean it's contrary to the Human Rights Code? In human rights, when you hear people say, we've always done it this way, the red flags start to go up, and they go up here. And many municipalities on their own are now looking at their zoning bylaws and saying, because of NIMBYism, we have built these things into dealing with maybe group homes or certain kinds of social housing that aren't there when you and I want to live next to each other. Why should they be there when people with certain certain characteristics protected under the code should be there. And so there are recommendations in the reports, and we're out there in a number of municipalities intervening and making changes. So our job at the OHRC is to deal with broader systemic issues. And we're doing that every day using all parts of our mandate to advance the rights and eliminate the barriers and discrimination that people with mental health and addictions experience. But it's not just at the code, at the commission, that we need to be pushing these kinds of changes forward. The preamble of the Ontario Human Rights Code makes it clear that we all have a responsibility and a legal obligation to proactively create equitable, inclusive environments. And it's not just about waiting until something bad happens. It's about looking to see where barriers or inequities exist and removing them before people are harmed by them, discriminated against, or when issues of tension and conflict come up. It's about raising awareness, changing underlying social attitudes. In the case of mental health, it's so often about removing stigma and making sure supports are in place and that people have access to those supports. We know that a lot is happening in post-secondary educations, and that university communities are dealing with this in a major way. And I was very pleased last week to see that the Ministry of Training Colleges and Universities launched a program with some money, 27 million over 3 years, so for particularly targeting post-secondary students in colleges and universities. And we know that it's so important that the issues be addressed there. One, because we know that the age of many students is when many mental health issues come forward, reveal themselves. But also, if young people aren't able to continue their education, because of those issues, we know that has a major impact on the rest of their life and takes us back in that vicious circle to the poverty, to the inability to find housing and all of those things. So I know that York cares about human rights. Somebody asked me today if I came up here often, and I said, actually, I do quite often these days, because York is a very willing partner with us at the Commission, and a lot of work around racial profiling, around competing rights, around creed or religion, different issues related to the code. York has worked with us on. So I'm very happy to have been invited here today to be a part of this conversation. It's an important conversation that needs to happen so much more. And I thank you for your strategy that includes this kind of conversation. They are, as the Provo indicated, often difficult conversations to have, but we need to have them. We need to have them often, and they need to involve the the senior administration and the staff and the students, really everybody who's a part of the community. And the good news is that when we have those conversations in a respectful way, that things change in a good way. So congratulations and thank you to all of you being here tonight, because this is a part of one of those important, respectful conversations, and we need every bit of it to get us going down the road in a good way. Thank you.